I'm Linda Capello, longtime International Medical Corps board member and a founding member of our Women's Luncheon Committee. Thank you so much for joining us today. We're thrilled to be hosting our first virtual luncheon. Many of you have been longtime participants in our luncheons, and it's been a true honor to build such a meaningful community with you. We decided this year we didn't want to pass up the opportunity to come together, no matter how unusual the circumstances. I especially want to thank our incredible committee members. We're so thankful for your leadership and commitment to International Medical Corps. Now I'd like to share a short video about our COVID-19 response right here in the U.S.
Coronavirus is a once-in-a-generation crisis, and like any crisis, we will only get through it together. That's exactly how we're supporting the fight against coronavirus across the United States now. International Medical Corps has been in the business of dealing with emergencies for more than 35 years, providing medical care quickly, moving people, supplies, and equipment where they need to be, because speed saves lives. In the U.S., our rapid response packages are helping hospitals across the country fight COVID-19. From Los Angeles to New York, to Puerto Rico, to Detroit and to Chicago, deploying emergency medical field units, getting personal protective equipment and other medical supplies to the front lines, putting volunteer medical staff where they're needed, supporting community testing.
The International Medical Corps works around the world. They are helping us surge our hospital capacity here in Los Angeles. Thank you.
We're there, providing expertise, equipment, training, and triage and treatment services, because that's how we'll beat the coronavirus. Together.
It's truly been incredible to see the work of International Medical Corps here at home. So it's with great pleasure that I welcome my dear friend Nancy Ossie to say a few words. As most of you know, Nancy is the awe-inspiring CEO of International Medical Corps, which has been working on the front lines for over 35 years with headquarters right here in Los Angeles. International Medical Corps is providing life-saving medical services here in our hometown to help our own communities fight this coronavirus pandemic while leading global responses in over 30 countries. Now more than ever, we are so grateful to have Nancy's fearless leadership guiding us forward. Please welcome Nancy Ossie.
Thank you, Linda, and hello to all of our dear friends. I hope that you and your families are staying safe and well during these very challenging times. This is an extraordinary occasion. For 18 years, the International Medical Corps Women's Committee has been bringing all of us together to support communities impacted by disaster, war, and disease outbreaks all around the world. We may not have imagined that we'd be gathering virtually this year, facing a global pandemic that struck us right here at home. Yet here we are. And even though we're physically apart, we're still united as a community. As you know, we usually come together to discuss our medical relief work that takes place thousands of miles away. However, this year, we're seeing firsthand how easily our own healthcare systems can be overwhelmed in an emergency, and how very suddenly our own lives can change. We have fears for our own safety. We have fears for the safety of our loved ones. It's all very confusing and it feels very uncertain. And for the first time, we at International Medical Corps are personally impacted by a crisis and also responding to it at exactly the same time. Amidst worldwide shelter-in-place programs and travel bans, we were able to launch one of our largest global emergency responses in our 36-year history. and quickly mobilized support first here in LA for our city's most at-risk populations. When the pandemic hit America and our own neighborhoods, we were ready. Our response was swift, broad, and deep. And our readiness was frankly due to the investments that people and supporters like you have made in our disaster preparedness and response capacity over the many years. It is your ongoing support that seeded our early action in this pandemic and continues to power our efforts. When reports first started coming out of China, our global health and pandemic experts began tracking COVID-19 long before much of the international community. Our logisticians around the world work 24/7 to secure millions of surgical masks, gloves, and ventilators that are now supplying healthcare systems across the world. Right here in Los Angeles and across the US and New York, Chicago, Detroit, and in other cities, our teams are continuing to build emergency medical field units and distribute equipment and supplies to hospitals. And our courageous medical volunteers are rushing in to relieve exhausted frontline health workers in our country. In the 30 other countries where we operate, our local teams have responded quickly to provide PPE, health workers, set up hand washing stations in refugee camps and at-risk communities, and educate hundreds of thousands of people on COVID-19 prevention. So far, we have screened over 200,000 patients, and we have trained more than 8,000 health workers on COVID-19 treatment and prevention. And all of this is happening because of you. In the face of a health crisis that has reached virtually every corner of our globe, we have mobilized quickly, we've worked tirelessly, and we came together in ways that we never thought possible. So much of it is thanks to your investments. Truly, when you think about our response today and you hear from our panel, think of this as your response. But the crisis is far from over. There are still spikes of cases here in LA. There are spikes of cases in other American cities. In the world's poorest and most remote countries across the world, Africa, or in the Middle East or Latin America, the disease is just starting to emerge. As you know, these places have extremely fragile healthcare systems. There are few doctors, there's little medical equipment, and the ongoing health challenges that the virus only going to compound. In our globally connected, highly interdependent world, a virus like COVID-19 transcends borders. This means that the most vulnerable amongst us will determine the health and safety for all. So we must continue to fight for quality health care for everybody. And we must continue to support, of course, our courageous frontline health workers that are risking their lives every single day. If there was ever a time to remember our shared humanity, now is that time. Whether we're sheltering in place at home or we're working on the front lines, we're responsible for one another. Whether we're in Malibu or Milan or in South Sudan, we belong to each other. And someday, when we look back, this moment will be defined about how we all came together. So my thanks to each and every one of you for doing your part, for your family, for your community, and for our world. The impact of your support is felt across the world, across the United States, including right here in LA. You know, we're going to get through this together, and out of it, we are going to emerge even stronger. I now want to show you a quick video on how your support is helping us here at home and serving our city's most at-risk communities.
Our hospital is located in South Los Angeles. It's an area of the county with traditionally a shortage of healthcare providers, underserved community with respect to access to care. Our emergency department typically sees over 110,000 visits annually per year, which is a really large number of emergency department visits for a hospital that only has 131 beds. When International Medical Corps started talking with us about ways and possibilities for help, we started to see some of the equipment that they could bring to the table to help us in preparation to actually care for patients. That's when things really change for us. We're definitely experiencing pretty significant volume of patients with COVID-19 on the inpatient side. The tent that we have now from IMC is really large. It allows us to really compartmentalize care for COVID positive patients or potential COVID patients. It's really been a cornerstone of our ability to respond to the current crisis and keep everybody safe and separated as much as we can. I just want to, thank the International Medical Corps for really stepping up and helping us. And I think it's really going a long way, to help us take care of folks here.
So we have a great panel discussion for you today. It's going to be a deep dive into our COVID response here in the U.S. It's going to be with some of our colleagues who are on the front lines of this fight. So I'm very excited to welcome our moderator, Nicole Young. Let me tell you a little bit about Nicole. As a longtime producer at 60 Minutes, Nicole has covered our work in crises and conflict zones for many years. With tremendous compassion and intelligence, Nicole, along with her anchor, Scott Pelley, have profiled our efforts to combat malnutrition that was ravaging young and old in South Sudan, as well as our efforts assisting Syrians whose country has been torn apart by years of war. Nicole began her career at 19 years old. 19. She was an intern at CBS News. She went on to cover the world's biggest events of the last 2 decades, including the earthquake in Haiti, the tsunami in Japan, US airstrikes in Afghanistan, the Boston Marathon bombing, and of course, the COVID-19 pandemic. So Nicole, it's great to see you. We're really delighted to have you join us today to leave our panel. It's really nice of you to do this. So thank you. I'll turn things over to you.
Your organization have been an incredible inspiration to me for so many years. I'm honored to be a part of this extremely important conversation with you and your heroic colleagues. I've already learned so much from today's panelists, and we haven't heard from them yet. I'm excited to dive deeper with them today. Joining us today, we have Ki Lu, Sue Manjicaro, and Dr. Scott Lillibridge. That's where applause would go. Dr. Ki Lu is International Medical Corps' Chief Operating Officer, responsible for overseeing all global programs, operations, and government relations. He has more than 20 years of experience in humanitarian response, including serving as the director of USAID's Office of Foreign Disaster Assistance. Ki is the founder of the Institute for Disaster and Fragility Resilience at George Washington University, where he also holds a law degree. Ki, I look forward to speaking with you today. You're an impressive person.
Thank you.
Sue Manjicaro is a registered nurse and a team lead director emergency response unit for North America and Latin America. She helps lead rapid deployment teams during emergencies and oversees the organization's integration into global emergency management systems. Prior to International Medical Corps, Sue held executive leadership positions at Heart to Heart International and Welch Allyn, a leading global manufacturer of medical diagnostic. She has a master's degree in public administration from the Maxwell School for Public Administration at Syracuse University and a Bachelor of Science in Nursing from Syracuse University College of Nursing. Sue, welcome.
Thank you.
and Dr. Scott Lillibridge, International Medical Corps' Director of Emergency Response for the Americas, has more than 30 years of experience in the field of medical and public health preparedness in domestic and international settings. He was the founding director of the CDC's Bioterrorism Preparedness and Response Program and has worked throughout the world in various international emergency response roles with governmental and non-governmental organizations. He also served as the medical director for the US Office of Foreign Disaster Assistance and has been active as a professor of epidemiology and biostatistics at the Texas A&M University. Scott, welcome. Key, I would like to start with you. Ralph Waldo Emerson said, "The future belongs to those who prepare for it." And there's no other organization who has mastered the art of preparedness quite like the IMC. How has the IMC and how was the IMC already prepared for the global response of COVID-19?
Thank you, Nicole. The International Medical Corps operates in the most vulnerable communities globally. And on a daily basis, we're confronted with armed conflict, with shifting borders, with disease outbreaks, and other operational challenges that requires our frontline staff to have to pivot and to adapt in order to continue to provide life-saving assistance. And I'll give you two examples. In the Democratic Republic of Congo, where we've been battling the second largest Ebola outbreak on record, our Ebola treatment center to date has provided treatment care to 3,500 patients. We have screened over 1.4 million people in 95 healthcare facilities, and our community health workers have been able to reach 3.4 million people in risk communication and surveillance activities.
3.4 million.
3.4 million. And we've done all of this in the face of armed conflict, operating in the most devastated and decimated health system. In Yemen, where there's a larger percentage of people who are facing death, hunger, and disease than anywhere else in the world, our staff are providing life-saving assistance on both sides of the country. And we're doing this in what is now considered the world's worst humanitarian crisis. And that's to say that our staff, we have no choice but to prepare for the worst case scenario.
You mean you have no choice?
We have no choice, because to do anything less would mean the difference between life and death for the millions of people that we serve globally.
You know, millions of people that you serve globally, IMC is used to, as you would, working in the hardest of situations. And it leads me to you saying, this is the worst humanitarian crisis we've ever seen, right? This right now, COVID-19?
No, I was talking about in Yemen, where
we're
facing, but this
pandemic is one of the worst health crises we've ever seen globally.
Yes.
The US is now the epicenter of this pandemic. And as an organization that normally responds overseas in places like Yemen, how did you pivot and decide to help here at home? And particularly your early response in LA?
Yes, this preparing for this global pandemic has been unprecedented, and clearly not just for humanitarian organizations like the International Medical Corps, but really the world's community that's faced with this. And for us, obviously, when we looked at how to prepare for our global missions, we quickly realized that the healthcare system in the United States would be overwhelmed. And therefore, we wanted to provide direct assistance to existing hospitals and urgent care facilities that are in the communities, that are on the front lines in Los Angeles, in New York, in Detroit, who are faced with high COVID patient caseloads. And what we're doing is that we're providing surge support, addressing three components in terms of space.
Surge support.
The need for increased critical care capacity, to increase ICU beds, to be able to move emergency departments off-site to care for these patients. And the way that we've done that is to provide medical fuel units that are attached to the hospitals and are managed by the hospitals. We're also providing critical PPE, which we all have seen in the past that there is a clear shortage. So with regard to the provision of masks and gowns and gloves, we're providing our hospital systems and partners with essential PPE. And perhaps most importantly, we have tapped into our volunteer medical surge roster to provide doctors and nurses who are leaving their homes and leaving their communities to be able to provide that critical care in hospitals that are overwhelmed. And to date, we are providing assistance to 22 hospitals throughout the United States. And we started this effort in Los Angeles with MLK Hospital, with USC, with Olive View. And we've moved from Los Angeles, as I noted, into the hotspots like New York, like Detroit, like Chicago, and Puerto Rico.
You know, people would be surprised that we're in the #1 healthcare system in the world, and yet it would still seem and feel so overwhelmed. Was IMC surprised by that?
It has been, I think, for everybody who's been involved in this response for the International Medical Corps, a learning experience, because we are accustomed, right, to hopping on a plane and parachuting into other communities that are grappling with failed healthcare systems. And to see this happening here at home, I think has been devastating on a personal level, but it's really allowed us to rise to the challenge and do what we do globally here at home. So I think that ability to be able to make an impact here within the United States, where we live, where our families are, has just been a tremendous opportunity for us to be able to serve not only the people globally, but people here at home.
Mm-hmm. Well, an organization is only as strong as its soldiers, and one of those soldiers is Sue. Sue, I know that you recently came from the front lines of New York City, and I know that IMC arrived in New York City on, correct me if I'm wrong, April 3rd? Good. And I think so many people are just interested. Could you describe for me and our audience the relief and effort IMC gave to New York City hospitals and staff at the height of the crisis? Paint that picture for me. What was that like?
The second. The third was our first day in the field, visiting the hospitals. So we had several of hospitals that were severely hit in New York City and the epicenter, in the boroughs in Queens, the Bronx, and Brooklyn. And we did our site assessments and met with administrators, doctors, heads of emergency departments and critical care units. And I've been serving the response works in Haiti since Haiti 2010 to today. And I can tell you it was one of the most devastating sights I've ever personally seen. There were patients coming into the emergency department in severe respiratory distress, ambulances backed up 5 deep. In one particular emergency room, there were 40 or 50 patients on stretchers waiting to be assigned a room. Other patients that were in respiratory arrest requiring resuscitation. The staff was overwhelmed. The system was overwhelmed. The administrators in tears because they felt helpless in being able to provide the care that they know these individuals needed.
I think so many people would be shocked to hear that that's New York City a month ago, in the greatest healthcare, the city with one of the strongest healthcare systems in the country, and it was that overwhelmed.
Absolutely. And I think that was true for myself, for the, again, administrators and providers I had one emergency room director say to me, "This isn't why I went into medicine. We shouldn't have to make these choices." I mean, completely and utterly overwhelmed. We're not expecting that in this country. We're not expecting the shortages that we had in supplies. We're not expecting a quarter of our staff to be out sick with COVID, and it was completely overwhelming and devastating. And for the families too, for the nursing staff and medical staff to see patients die alone was overwhelming. To have to communicate that over the phone to families and watching families show up sometimes to emergency departments hysterical because they found that out that their parent died a couple of days ago is very, very overwhelming and shocking to say the least, because this is unprecedented, certainly in the United States, really across the globe, but certainly not anything we're used to in this country. We're used to being able to save lives, and the volume of deaths in New York was also overwhelming. My first day of arrival, there were 2 refrigerated trucks for the expired. By the next day, there were 3, and 2 days later, there were 4. And it was very sad to see, so many patients coming out, going to the trucks as it were and seemed like going in. So totally overwhelming. The morgues couldn't handle the volume. They had 7 times the number of expired in 4 weeks than they normally do. So you can understand why the system was overwhelmed and at a breaking point.
It almost seems unreal. It seems apocalyptic of sorts. And you mentioned so many days that seem unbearable, unrealistic, non-realistic. And I hate to ask, but take me back to the hardest day for you and your team.
I think the hardest day was the day that we were setting up actually our surge capacity tents at one of the hospitals, or a safety net hospital in Flushing, New York, which is both culturally, ethnically, and racially extremely diverse and has a very vulnerable population. That day that, as I mentioned, there were 5 ambulances, or 6 at times. The patients that were coming out were all in respiratory arrest, or looked as if they might be. They were, doing chest compressions, bringing patients out of the ambulance, bagging patients coming out, and going into the emergency department and listening to the doctors and nurses, really in tears over what was going on. And at the same time, watching the bodies come out the back. That was probably the most difficult day for, I think, everyone. And it was, as I recall, either the peak day or near the peak. And so understandable that everyone was overwhelmed. And the good news is slowly the surge capacity was built between the extra room in the facilities that were brought up, or in the hospitals adapting to the need for critical care beds and converting beds that were not critical care into critical care. Bringing equipment in that was necessary and required, the ventilators, the monitors, into nurseries that were converted, or rehab beds that were converted. So I think that was the worst day and the peak day, and slowly things began to kind of decompress just a little bit.
Right.
Give the hospital system breathing room.
Well, not all heroes wear capes, and Sue, you are one of the many heroes that we all should take the time to honor. Before COVID, we should have been doing it during this pandemic, and definitely after. We applaud you. We applaud all of the team members that have worked with you and continue to work hard every day. We're grateful to you and everything that you do. It's listening to your accounts and recalling those hard days, and all of them seemed hard in their own way, which is why we're all staying at home. We're all here because we're trying to not have the buildup of bodies and refrigerated trucks, which I think a lot of people may be having a hard time understanding. Well, why do I still need to stay at home? Well, whenever you need a reminder, everybody, go back to what Sue just talked about, which also then now leads me to Scott. Scott, how are you? Great. I can hear you well. You know, it makes me want to ask you now the question after listening to Sue. You know, we're all at home. We're all getting a little tired of being at home. I think it's the idea of, well, you know, it seems to be slowing down is in everybody's head. But what can the U.S. do, and should it be doing from a public health perspective to respond to the pandemic and ultimately save lives?
In this disease, we think there's a component of transmission, at least that's manual or surface related. It's not the main way, it's droplets and cough and breathing and so forth. But there is a contact element, so wash your hands. Avoid contact with people who are sick. These are common sense things. We ask people not to go to work. We don't go to people's houses. We send people home from the workplace now if they're sick. We do that with more vigilance than we have in the past. We used to tolerate that in coworkers. This is probably a bad time to do that. So, and the last thing is frequent cleaning and disinfection. Some people have cleaned their groceries and so forth before they bring them in the house. They take their shoes off, clean doorknobs, light switches. All those things are excellent ways to prevent the transmission of disease. Your second question is, what should we be doing as a nation? And we leave that in the hands of our public health community. And their strategy and their tactics are sometimes hard to see, because if they're doing their job well, then we really don't see them working. We are beginning to do massive screening to identify where the target, where the infection is, where the people who are infected reside, and so forth. And then we intensify surveillance to follow up on their contacts. And then we enforce isolation by having them remain at home, knowing that they are potentially infectious. And with that, we get the mosaic of where the strategy needs to focus, what part of the country, when can we relax and begin to open up and reduce our shelter-in-place strategies.
Well, you know, you talked about the mosaic, and I think that's the biggest, one of the many big questions we all have, is we're still sitting at home and wiping down our groceries and, you know, not doing a formal handshake to a neighbor and waving from afar. And, you know, how do you see the pandemic evolving in the coming months? What does the future hold for us?
You know, here's what I think. In the United States, we've had a really rough patch in late March, April, and we are now entering a phase where the number of ICU cases and the number of deaths are beginning to diminish or stabilize. And that's good. When you look at the hospitals that we've been to in Detroit, New York, Chicago, Puerto Rico, Los Angeles, we see the hospitals are not as overwhelmed. We're beginning to see beds opening up. And that's a good sign that the peak may be over in terms of its morbidity and mortality on people. We still have to remain vigilant because we see the disease is still transmitting locally in some areas. The focus will shift in the United States to those areas where there's high transmission, and we'll begin to intensify our public health actions in those regions, while at the same time beginning to relax our public health restrictions in other regions. This is going to be a mosaic. Other places peaked at different times. It's a big country, and we have different risks and different risk populations. And we're going to tailor that with our public health community. We're going to be working intensely at the state and local level, because it's really moved from the federal government making interdiction of borders down to the states the past 2 months, and now it's moving down to the community and county level. So you'll see highly targeted interventions happening over the next few months.
Well, which leads me to another question. You talked about some communities where the disease is lifting a little bit, and then some where it's really impacting. And we have seen that COVID is hitting certain groups of people harder than others. And I go back to Sue for a second off of what Scott said. Sue, why is COVID hitting certain groups harder than others, like the African American community and others?
Yeah, that's a great question. And I can tell you from what we saw in New York, from a very vulnerable patient population, right? Minorities, individuals, low socioeconomic status individuals that seem to have it strike them at much higher rate. You know, what was explained to me is that many of those folks are not receiving preventative care, comorbidities, do have poor nutritional habits, et cetera, and obesity, and therefore are more at risk. Certainly in the regions that we were serving in Brooklyn and the Bronx and Queens were certainly those populations, and I assure you they were hard hit, and they do believe that there's a correlation there with respect to, you know, to begin with starting out at a disadvantage from a healthcare perspective.
You know, and that really then makes me think, you know, you have these poorer, more densely populated communities in a lot of cities, LA County, New York City, the Bronx, you have New Orleans, where Key is based. You have a lot of these more impoverished cities. The honest part of it is a lot of those cities have minorities in them. And so it's hitting a minority community based on just the way people live and how they live and how they can afford to live, the accessibility. But if you think if it's hitting those communities that hard in America, how is a community in sub-Saharan Africa or in Yemen or the Middle East or Haiti ever going to have a fighting chance? Which then leads me to Key, you know, talking about the global response. How do you, you know, these countries in sub-Saharan Africa and Middle East that are just starting to see cases, what do you foresee happening there? How do they even fight this?
I mean, I guess that is what's keeping us up at night. I mean, if we see what's happening here in the United States, in Western Europe, where the health system, you look at the Global Health Security Index, these health systems are in the US right are at the top in terms of capacity. When we're talking about Yemen, we're talking about South Sudan and Somalia, they're at the bottom. And we are very aware that the numbers of confirmed COVID cases have increased every week for the last 2 months. And they are behind. We're not seeing the same numbers that we're seeing here in the US or in Europe, but we expect those numbers to increase steadily and to overrun and decimate the health system. And I'll give you an example here where the United Nations recently put out a warning that you can expect upwards of 3 million people to die in Africa with 1 billion infections.
From COVID.
From COVID. And we've been looking at here in terms of how quickly our hospitals are overwhelmed and how we have increased our critical care capacity, perhaps moving from 50 ICU beds to 100 ICU beds in hospitals. Yet if you look at South Sudan, they have 24 ICU beds and 4 ventilators for a population of 12 million. This is what we're dealing with in terms of the disparity between capacities. So yes, we are very alarmed, very concerned that in the next few weeks here, those numbers that we're seeing here in the United States, in Western Europe, we'll find that in Somalia, in Yemen, in Syria, and we are bracing ourselves for the just staggering numbers of deaths.
Gosh, it doesn't seem, again, it just doesn't seem real. And you mentioned it, but in just short answer, knowing that that's ahead of you, what is your greatest worry?
Our greatest worry is how to provide for the physical well-being, the mental well-being of our staff who are in the front lines. They've been at this now since February. They've been away from, many of them, their families. They are operating in countries, communities where, as I pointed out, right, 24 ICU beds, 4 ventilators. What happens if they get sick? How do we get them out when the borders are closed? How do we bring in PPE supplies and equipment, again, when the borders are closed? How do we evacuate our staff How do we take care of our national staff who are distributing perhaps hand washing sanitizers and systems to our beneficiaries, but then they go home and there's no running water for them to take care of their own families.
Or soap, or
Yeah,
anything.
it's really where our focus is on our staff so that they can continue to carry out the life-saving activities that they've been doing day in, day out.
You know, the effort nationally, globally, it just seems Herculean. It doesn't seem like there is enough of anything that anyone could give to fight this. And I ask this question to all of you. Scott, you can be the first to answer. What resources does the IMC need today to continue to deal with this fight, to continue to fight COVID-19, but also to fight something else in the future? Because this is definitely not the last pandemic we're going to see.
Not at all. You know, I've had 3 major epidemics, and this is the 3rd one this year. And given the emergence of new pathogens and contact with the jungle and deforestation and so forth, many people predict this is going to be a regular phenomenon. We're going to have novel pathogens create epidemics in the future. What we really need is to refocus on our international activity of developing critical healthcare infrastructure. And that's how we approach this. We strengthen the public health elements, the disease detection, the clinical elements of teaching people how to extend and rebuild their fractured healthcare systems. Now, remember, the places we serve are often in the wake of civil wars. And civil war is just public health in reverse. It destroys infrastructure.
Sure.
And then what's left are women, children, and disenfranchised populations at the mercy of infectious disease and so forth. So that going forward, we're going to focus on the tools, collect strategies to develop the infrastructure, and look for the resources to extend our programs to these critical areas all over the world.
Sue, as a nurse on the front line, what are some of the things that you see or that you continue to see that are needed?
Yeah, I go back to one word that I often associate with International Medical Corps, and that's preparedness, right? So we were not prepared as a nation. The world was not prepared for this pandemic. And so preparedness being both training for the people so that we're prepared and know what to do and how to do it so that our staff doesn't end up with the same disease that we're taking care of patients for. Preparedness in the way of supplies so that we have sufficient supplies and aren't caught again without PPE to protect the people on the front lines. Prepared in the way of equipment so that we have sufficient ventilators and monitors and stretchers and IV units that are critical in this time. And preparedness in the way of surge capacity. How do we ramp up and create that additional space for those critical care patients so that the system's not overwhelmed and that we create more of a crisis than need be. So I look at it in totality around that one word, in being prepared. Right.
Well, Key, I'm going to leave the last thought to you, our COO, and it's what is something that the IMC is learning from this crisis?
I think we've learned that we're all first responders, right? And that we all have a role to play within our families, within our communities, and at a global level. And I'll end by quoting the Dalai Lama, where he said that it's with the greatest adversity that there's the greatest potential to do good, both for oneself and others.
Wonderful. Well, time always seems too short when you have exemplary people helping us make sense of this unprecedented health and economic crisis humanity is facing. For 35 years, the International Medical Corps is always the first to arrive and thrive. They are always preparing for worst case scenarios, partnering with existing establishments, and the passion of their staff and volunteers is unparalleled. Preparedness, partnership, and passion are what make the IMC a face of confidence in chaos. It's been an honor to personally witness the IMC's work. Dr. Kilu, sorry, you're not a doctor, you're a lawyer. CO Ki Lu, Dr. Scott Lillibridge, and Nurse Sue Manjicaro. Thank you. We are humbled to hear from all of you. Thank you for your courage. Thank you for your time away from your families. Thank you for your tenacity. Thank you for your calm. And the world needs each and every one of you and everyone else you work with more than ever. We need you now. So we applaud you. Thank you for your time and for your expertise.
Thank you, Nicole.
Thank you.
Before we turn it back over to Nancy, we'd like to share a short message from a medical volunteer who just returned from Brooklyn, New York, where she was working in a COVID unit.
My name is Amy Bowen. I'm a registered nurse in Missouri. I just got back from a deployment in Brooklyn, New York for the COVID-19 pandemic. I was at a hospital called Maimonides. Almost every patient we had was COVID positive. Everybody has to be, completely invested in these patients. You're their only person. So you go in and you visit with them, you take care of them as if they're your mom or your dad. And then they just keep getting worse. So I think it's taking a mental toll on everyone, but everybody has really pulled together and become a big family because it's apparent you can't do this on your own. Your donations, your funding has allowed nurses like me to come to the front line and help and be the extra hands that they need to allow the nurses that are at the facilities to be better nurses, to take better care of these patients, to get better outcomes. I can't even tell you how many times I heard thank you. Thank you. We would never have been able to do this. This is far from over. And with your continued support, we are able to go back in and send more nurses and help out and make a difference.
Of course, your generosity ensures that frontline health workers like Amy, like Sue, are prepared to serve. Many of you ask, what more can we do? Well, as you know, there are many ways you can continue to support our frontline health work and help us save lives. You can go to our website and make a donation. You can talk to our team members about how to get involved. And you can especially help us just spread the word about our work. I want to thank you, Nicole, for facilitating such a meaningful conversation. Really, really appreciate that and appreciate having you with us today. And Key and Sue and Scott, I want to thank you for sharing your insights today. You awe and inspire, and it's such an honor to work with you. I want to say something to each of you who've joined us today for our first ever virtual luncheon. I'd like to thank you. I know we have a lot of supporters listening in right now. I can't begin to tell you how much your encouragement, your optimism, and your continuing faith in us keeps us going in the toughest of times and helps us be prepared for whatever disaster comes next. I hope that our work makes you proud. I hope that you know how much we appreciate everything you do. And I hope that you enjoy today's conversation. We look forward to seeing you all again very soon, hopefully in person. Until then, let's stay safe, let's stay connected, and most of all, let's stay hopeful for our future. Thanks again.